Today we will be discussing osteoporosis, the risk of developing it, risk stratification, lifestyle advice, therapy, and monitoring.
Osteoporosis does not discriminate age or gender. However, advanced aging plays a large role in the risk for fractures in older adults. Healthy bones should not fracture when sneezing or coughing. Those who are at risk of developing osteoporosis should be mindful of their diet and exercise. Nutrients is a key factor in building muscle and strength, which in turn decreases the risk for falls. High-risk factors can include those who have a family history of hip fractures, those who have pre-existing medical conditions that affect the absorption of calcium and vitamin D, other conditions such as long-term steroid use like use of prednisone, or natural hormonal changes in both men and women, smokers, caffeine, and alcohol consumption all impact the absorption of necessary vitamins needed in bone growth and maintenance. We can direct you to an online website called FRAX, F-R-A-X, that is used to calculate and determine whether you're at risk for falls in the future.
Fracture risk estimation are categorized into low fracture risk, which is less than 10% chance of fracture risk in the next 10 years, moderate fracture risk, which is 10 to 20% chance of fracture risk in the next 10 years, and high fracture risk, which is more than 20% chance of risk in the next 10 years. A DXA BMD is a form of X-ray technology that is used to measure bone loss, in addition to other tests, to further classify which clients are at risk for osteoporosis or fractures. It also guides treatment by altering client care to prevent worse outcomes. This graph shows the indication of bone density scores. A score of -1 and above indicates normal bone density. A score of 1.1 to -2.4 indicates osteopenia. A score of -2.5 and below indicates osteoporosis.
Osteoporosis can be prevented by adapting a healthy lifestyle and living in moderation. If you are a current smoker, you may be at an increased risk for developing osteoporosis. By quitting smoking, you're helping to prevent it. Drinking alcohol and coffee increases your risk, as well as lack of exercise and movement. By adding foods rich in calcium and vitamins C and D, you can help prevent osteoporosis, as well as living an overall healthier life. Foods rich in calcium and vitamins C and D include oranges, cheese, yogurt, fish, and broccoli. It is important to keep in mind that some medications can increase your risk of developing osteoporosis and increase the risk of falling. By adding exercise to your daily life, you can prevent osteoporosis and live a healthier life. Prevention of falls and the assessment for risks is the #1 way to prevent osteoporosis, breaks, and fractures. Increasing your muscle strength can prevent your risks of falls.
In order to make appropriate changes to the client's plan of care, it is important to continually assess medication side effects, compliance to medication schedule, loss of height, instant fractures, and change in falls risk. In addition, while bone mineral density testing is not always required, tests may be recommended after 3 years for clients using medication to treat their osteoporosis. For women over 65, bone mineral density tests should be conducted annually to indicate bone loss. Constant test scores show 0 bone loss and therefore effective treatment. For clients with multiple risk factors or the use of higher dose steroids, bone mineral density tests should be taken at 6-month intervals to assess any changes. If possible, bone mineral density tests should be done on the same machine to avoid discrepancies in data.